All right, October is Breast Cancer Awareness Month, but that's typically the most common cancer associated with women. But Dr. Kevin Chen, medical oncologist at MedStar Health, is with us tonight. But let's start off talking about colorectal cancer. When you think about colorectal colon cancer, you always think about the colonoscopy. What is colorectal cancer?
So we usually define cancer based on what part of the body it started from, as opposed to where it ended up, which would be metastases. So then colon cancer would be a tumor that originated somewhere in your lower intestines.
And the difference between colon cancer and rectum cancer?
So the rectal cancers are just the extension of the colon at the very end of the colon.
Mm-hmm. Now, I think it's men. Who's more common to receive it?
That's right. Colon cancer is very common for both men and women. It's the third most common cancer for men, the third most common cancer for women, but there is a slightly increased rate for men than women. That being said, it affects everybody, and so screening is universal.
And screening is critical.
Correct.
As you said, the colonoscopy, the gold standard.
The gold standard, correct.
Have they made it better?
Well, there are less invasive methods nowadays, but and most people will complain about the prep. Getting the prep the day before, clearing out your colon is the worst part. But it is definitely necessary so that the gastroenterologist can get the best look in your colon and clear out any polyps before they can one day turn into cancer.
Talk to us about the risk factors.
So there are many risk factors for colon cancer, some of which you can do nothing about. Mm-hmm. So for example, age. As you get older, that increases your risk. Also genetics, family history, something your family passed down to you. Also some of your other medical problems, such as ulcerative colitis or Crohn's disease, will increase your risk. But then there are some things which you can alter. For example, smoking, mm-hmm. alcohol abuse, obesity, sedentary lifestyle, even better dietary choices. For example, consuming less red meat.
Mm-hmm. So basically a healthier lifestyle, like associated with everything else.
Exactly.
How do you treat it?
So we treat colon cancers very differently from person to person, case by case. Sometimes you'll offer surgery, where a surgeon will cut out the piece of the bowel where the cancer is growing. Mm-hmm. Other times you'll want to radiate the whole pelvis in case the cancer is spreading regionally. And then other times we might want to give drug treatments where, for example, chemotherapy that goes into your body, travels everywhere to try to kill the cancer that might be spreading or trying to spread throughout your body.
Mm-hmm. So you basically remove the polyp and then you treat whatever you found in terms of the body.
Absolutely.
Talk to us really quickly about molecular profiling. That's a new one.
Sure. So that is the future of cancer treatments, where we are taking your tumor sample, sending to a lab for special analysis, and depending on the tumor profile, that will help us guide our treatment, where we know certain profiles are sensitive to some treatments and some are resistant. By doing this, we hope to achieve personalized cancer medicine where every individual gets the very best treatment possible.
All right, Dr. Chen, one of our many experts in the house. The number to call if you have questions, 410-671-0702. MedStar Health taking your questions today.